Hi, I was supposed to have this conversation between 3 and 3:30 India time today, and the idea was to share a little more about HBH, a little more about the vision of HBH, extending beyond the introductory mail that I had sent almost a month back. Now, I have been sharing regularly regarding the updates on the website, and those of you who have been visiting it are versed with it. I hope you have been. We have also entered into a agreement with the Ayush Ayurved Hospital University Trust at Iceland. That is an information that has been shared in the public domain. I have also shared that we would soon be looking to hire people, particularly Ayurvedic doctors, on a certain format wherein we would be working all across the spectrum, and at the same time we would be guarding the fact that we are not sharing patient information outside. I have also taken a step further to make Prakriti evaluations a little more advanced, more Srotas specific if you look at the Ayurvedic context of it, and at the same time the final report giving it a picture of more modern science aligned, making it more patient friendly to understand. All that given, it is more important that we understand what HBH is all about. When we say we bring the family doctor on the web, and when we say health beyond healing, the basic concept, and this is one thing that needs to drill down very, very heavily, is that we will be limiting ourselves from prescribing medication as far as possible. We have to make people used to a certain improved or modified lifestyle so that they remain either illness free, or if they have long standing illnesses, the illnesses are maintained as where they are, or if they have a very serious ailment, say something like a cancer, they get quality care, and if you cannot do anything better, at least make the end simple, easy, and as far as possible painless. This will call for a lot of coordination between the team. This will call for a lot of improved communication between the team. This will also call for being team players rather than individual players. Remember, we have things coming up which will be individual responsibilities, but that would not mean that you are not a team player. You would be willing to share information across when required, though patient information is always private, so you have to be on guard as well. No information regarding a case or a patient should go outside the personal or the team discussions. That also includes that information is not shared amongst doctors unless required, and it follows a certain protocol wherein your mails are to be personal mails. I insist that personal mails on your HBH web, not your personal Gmails or Yahoo or whatever. I insist this because you can remember that your personal mail IDs that have been assigned to you are also by way means of non-disclosure agreement, even if not written so. While you use your official mail, your exchange of information is official, and when you do not, it is not. So it is very, very important and integral that you stick to the line. There's a lot more coming up on HBH. We have plans to have specialized lifestyle packages, specialized disease-based packages, specialized gender-based packages, which will also include people in the transgender world, because as physicians we cannot discriminate. So if you have any objections to any such conditions of working with, say, transgenders, you can let us know in private, and we will either try to solve that problem, or we will not share such cases with you, but with those who are willing to take such cases up. Because we as an organization level cannot be discriminatory. Similarly, we will have work slowly starting coming from different places in the world. I look forward to each one of you kind of promoting HBH, talking about it to your people. Revati will give me a few basics, basis of which I'll be designing certain handouts for certain programs, and all those will be shared. It's now our responsibility as a team that we do not let efforts of each other go down. We must be ready to promote it, because promoting HBH will mean promoting ourselves, and the moment we promote HBH, we promote ourselves, and at the same time we will be having a volume of work that will come across. Revati is coming out as an example, I must say, enrolling her mother for one of the flagship programs that we are just initiating, a general cover program which will address only diet and nutrition, no medical illness as such. It will be a program where every 15 days you will be taking a call with the patient, discussing his diet, discussing his lifestyle, discussing his exercises, and I also will not be involved in those calls. Remember, that will be your call entirely. It is just that my role begins with assigning the patient to you and ends with the Prakriti assessment of the case. Beyond that, it is going to be entirely your personal thing. Not only that, remember, all the performances will be monitored. That means there is something more to come your way down the line, not right now. I cannot promise anything at this stage. But if you are a good performer, something that I can promise at this stage is that you will have a lot of work coming your way. If you're not, I'm sorry, I cannot share as much work. So you need to be performing. You need to be coming up the ladder. You need to be working on things that matter, which means you have to study. And study both modern literature, study both Ayurvedic literature and beyond, for which I had suggested be a part of Twitter, enroll with journals of various streams, journals of, say, oncology, of molecular biology, of other streams, and keep reading their feeds, keep reading the information that they keep sharing, and upgrading yourself, improving yourself. Try to discover what is there that Ayurveda also says. Maybe come back and discuss it in the group. That the entire doctors group is not for my messages. It is supposed to attract messages from you people, your questions, your experiences with patients, discussions on them. Let everyone evolve. The idea is knowledge sharing. The idea is improving each other. That's what is called as team building, team performance, being a team player, sharing a birthday message, sharing a Happy New Year message is a part of it. You have to share your joys, you have to share your pain also. A mishappening with you, you need to inform so that we take care of things for you during that period. But at the same time, you need to be sharing your knowledge, your experiences, and helping people grow each other. Remember, knowledge is the only treasure which grows by sharing. So don't forget that. Let's stick to a very good line. We are coming up very well. I have my observations of each one of you. and maybe after another 2 months, once it's some time spent, I will share my observations with you regarding how you're working, how things are going for you, what you need to do good and what you need to do better, how you can come up the ladder, improve yourself. There's a whole lot of grooming activity that will go on. And remember, if you do not know English, don't worry. You know something of it, keep sharing. You will improve once you share, once you talk, once you write. Not that you just shy because you do not know it. So things are there. Each one of us has deficiencies. I have my set of deficiencies. There's a whole lot I have not studied. I need to study. There's a whole lot I just do not know about. I need to know. You people teach me many times. There's a lot that I have learned across my 2.5 years of experiences in discussions with Jasmeet. There are few things that I have learned with Radhika in the last 6 months. There are some things I have learned or I've just started to pick up from Swati. There's a whole experience of life that Revati has taught me in 7 years that we have been together. It's a lot of improvement in terms of knowledge and approach to things, if I have to say, with Dr. Thurston around me, and it definitely is a fatherly presence for us if it were to be in a professional domain at least. So Dr. Rekha is another member of our team who lets you learn a lot of things through her ignorance sometimes, or her just ignorant presentation. So each one of us is teaching each one of us. It is better that we interact more and more as a team. Please, I insist, share your questions, your doubts, your learnings, information that you read. Not keep it to yourself, shine what will people think, and do not make it such that it is a one-sided communication happening all the way just from me, because I don't love being a boss. Yes, I am a senior, that is by virtue of time and age. I have my set of experiences because of time and age, but I am a boss only when it comes to, say, giving or passing a certain instruction on. Beyond that, I am just one of you, a lesser qualified individual, if I have to say, compare with Jasmeet. She's a post-grad, I'm a grad. I'm a post-grad in a different science. I'm a finance graduate. So, but then Revati is better than me there, being a chartered accountant and a company secretary. Intermediate, she's better than me. So, there's a lot that I have to learn from you, and that is my selfish part, that you got to teach me, or if you do not, I will make you teach me. But I somewhere expect that you also have that approach in yourself, that if I or someone else is teaching you, fine, else you learn from them. That's how, as physicians, as human beings, you will evolve. Another important reason why this is important is because the time that is going to follow the post-COVID scenario is going to come with a scenario, with a situation where value of human nature, human expectations, human presentations, human relationships is going to be much, much bigger, much in terms of tangible value than the present day discourse of money and wealth. Because the way human population will shape up following this crisis over the next 3 to 5 years, and the kind of psychological impact this leaves, there's already a lot of transformation happening at social level, at family level in Western societies, particularly where solitude and privacy are very big things, and they had a different quotient of respect that they had, and people are moving back towards community and family life. That is to insist upon that man remains a social animal and he is not a solitary uh, individual who will just survive on his own. Keeping these things in mind, keeping the ideas intact, keeping the future intact, we have become individual robots living on, to say, mobile messengers, WhatsApp, and Facebook calls, etc., etc. But if we just go beyond a step further and start socializing, even on these networks, restricting ourselves away from photograph and video sharing to actual conversations. Yes, probably paucity of time, given the situation that you cannot physically meet people, yet engaging with them in conversations will let you learn, let you evolve, let you share, let you come off a lot of psychological pressure that these situations have built on. I would want to summarize this now because this is how it goes. That HPH is a family. We are going to have lot many people in this family. It will be a big one. Remember, it's not a family of, say, a few non-doctors and lot of doctors. It's a family of patients. Each of our patients has to be it's got to be a patient group altogether. We got to nurture that concept. We need to make these patient interactions more valuable, make patient to patient interactions more, need to have people engaging with each other, and we kind of become coaches for them, we kind of become tutors for them, we kind of help them evolve into ideals of some kind, and as doctors we just become friends. So it's HPH is a health beyond healing, which means there is limited role for medicine. It's all for humans, all for experiences, all for ideas that let you be a more healthy, more evolved and a better human being for a better community, a better world and a better society. I hope the team understands these things, and I hope that you will deliver going down on these values and these principles. Thank you.